At Dayton Interventional Radiology, we're looking at leg pain from a revolutionary standpoint. We're in a very unique vantage point where we can look at these patients and diagnose these patients and look at some of the things that are maybe not so obvious on the first pass for a lot of other doctors. We can categorize leg pain into 2 or 3 broad categories that we're evaluating patients for. One is back pain that causes leg pain. This is something that a lot of patients maybe are not aware of, but maybe if you're having leg pain, it's really coming from a nerve problem in your back. Well, if you go to a leg pain doctor, or if you go to a doctor like an orthopedic surgeon, maybe they're not going to be looking at your back as a potential cause for your leg pain. Sometimes patients have leg tiredness or fatigueness or this throbbing, aching legs, and it's due to your veins that are in your legs. Bad things that cause heart disease cause disease of the arteries that are going into your legs, like high cholesterol, family history, smoking. Just like narrowings in the heart arteries, you can get narrowings in the leg arteries, and if we don't treat these arteries, bad things can happen to your legs, eventually even amputations. The other vessel, which is the veins, are something that are commonly missed. That's problems with the veins affects actually way more people than the arteries. Almost 50% of patients over the age of 50 will have some problems with their legs. The problem is that the symptoms are very vague. You know, who over the age of 50 doesn't have a little bit of leg pain or tiredness or fatigueness? In the older days, we used to strip the veins. A lot of patients hear that somebody in their families maybe had a vein stripping. It was a surgical procedure where we put this wire in and kind of strip the vein out, and it'd be kind of a painful endeavor. But now with new technology, we no longer need to strip the veins. What we can do is close them down from the inside. And again, this is intended for patients who really have a problem. Very similar findings are in patients who have blood clots. People know of other patients who have blood clot or a DVT. These are blood clots that are in the leg that cause leg swelling, tiredness, fatigueness, and this is something else that we will evaluate patients for. Most of these procedures are, again, minimally invasive. They don't require any general surgery or anesthesia. And we can reopen these blood vessels, and even opening up even a tiny blood vessel can oftentimes result in significant clinical relief of the patient's symptoms. The other major area that we're focusing on is nerve pain. Many patients have leg pain that's due to little nerves in the leg causing pain. What I like to call is short-circuiting the little tiny nerves underneath the skin. This is called peripheral neuropathy. This is a concept that very few people really know too much about, and there are not a whole lot of treatment options for peripheral neuropathy pain. Patients will complain of a spectrum of problems from numbness to excruciating, burning, tearing, ripping type of pain. And unfortunately, there are not a whole lot of treatment options for these patients. Most of those include medical management. So there are a few drugs, but most of the time these drugs don't help, or they don't help completely. And so we have this really fascinating cutting-edge procedure. It's called a spinal cord stimulator or neuromodulation, which is phenomenal in helping these patients. We have the advantage with all the equipment and technology that we have to offer, and all the different types of procedures, to kind of look at leg pain from a different point of view altogether, and bundle this in from a perspective where we can offer you not only a diagnosis but a treatment option, and a treatment option that isn't going to require any kind of major surgery or doesn't have a high risk profile.